Hi everybody, my name is Rebecca Bracken. I'm Operational Manager for MHSOP Services, and I'm just going to give you a quick update today about equality, diversity and inclusion and what's going on in the division and the directorate. So MHSOP Services want equality, diversity and inclusion embedded into everything that we do. We want it to be part of our everyday culture for staff, service users and for carers that are using our services. We want everyone, including people of all protected characteristics, to feel welcome and accepted and at ease, whether they're accessing or actually working within our services. We really want to provide equity of opportunity to all people that are working within our services and ensuring that they get the opportunity to have interesting careers and access to equal training and development opportunities. What we really want to do is make MHSOP a really great place to work. So for those of you that aren't aware, we do have a divisional EDI lead who is Maxine Davis. Maxine's been working on a divisional strategy for EDI for a little while now, and she's been concentrating on developing an action plan focusing on key priorities for the division. So currently there are 11 priorities that she's focusing on. So I'm just going to go through those with you. Sitting under each of these priorities, there are specific actions that we will be held accountable for. I'm not going to go through them because I think currently we're sitting at about 86 actions associated with these priorities. But just to go through the 11 priorities for you. So we've got the first one, which is to develop a workforce that's inclusive and where diversity is celebrated by all of us. We're going to improve workforce representation of diverse groups to reflect the diversity of service users and our local communities. The third one is to increase representation of protected groups at all levels where they are underrepresented. We want to ensure that BMA staff and colleagues are to be treated with dignity and respect, and that they're valued by all colleagues and patients. And we're going to address racist discrimination and abuse in all forms. Number 5 is to improve quality and quantity of engagement with local community groups. And 6 is to increase BMA populations early access and ensuring that they get equal and timely access to mental health services. We're going to proactively address reducing health inequalities, meeting the needs of those with protected characteristics when developing and changing services, ensuring that they're involved in every aspect of planning and changes within our services. We want to make EDI everyone's business. It's really important that everybody understands what EDI is and what our priorities are. The executive leadership team will be seeking assurance from us all that services are performing for all groups of people, particularly those protected by the Equality Act 2010. We want to improve parity of mental health and physical health care. There's a lot of work going on across the system to ensure that we do get that parity for both groups of patients. And there's a lot of work going on in the Trust around developing digitally enabled pathways to ensure that we include all patients from that perspective. So those are the 11 priorities that we're currently working on. And as I say, we've got a lot of actions that we've got to work on to ensure that those priorities are met. So MHSOP have developed a 3-year strategy in line with the divisional priorities. And we're really focusing on 5 key areas. So that's training and development, service delivery, workforce, leadership and engagement with our staff. The strategy will be shared out with everyone following this event. So we want to use the partnership day as a bit of a platform really for launching this 3-year strategy for MHSOP EDI. We're working with Maxine on developing the role of EDI champions across the trust, the division and the directorate. And our aim is to really get an EDI champion into every one of our teams, with a hope that we really invigorate the MHSOP EDI network, which was previously led by Julie Aitcher. So there's lots of work around planning what the EDI champion's role and responsibilities will be and how they link in with Maxine, and training associated with the role, and ensuring people that would like to take part in that role, that they have the training and support that they need to be able to do that effectively. So just to finish up, I just wanted to let you know there are many trust communities of interest around EDI and networks related to BME groups, LGBT plus groups. So we've currently just re-established the LGBT network. So if anybody wants to be involved in any of these community of interest networks or meetings that take place around equality, diversity and inclusion, just let me know. There's lots of information on the Connect website around this, but if you want to link in with me, drop me an email and I'll be more than happy to direct you in the right way. Okay, it's a bit of a whistle-stop tour for everybody around EDI, but I hope that's just giving you a little bit of an update, and we'll be sending out the MHSOP strategy for you all to have a look at following this day. Okay, thank you everybody. I hope you all have a lovely Christmas. Bye.